Over 10 years of devolution and a tough war between the counties and the national government over the health function persists. The county chiefs are crying foul over perennial cash crunch in the counties, saying it is a deliberate effort by the state to claw back the gains made in the implementation of the health function, which is currently facing a myriad of challenges. The standoff comes at a time counties are owed 94 billion shillings by the national government, even as President William Ruto reaffirmed his commitment to defend devolution, contrary to his previous talks by the unionists allegedly seeking a reversal. Eleonora with more.
10 years of devolution and a goal to achieve universal health coverage is facing headwinds despite being a major milestone in the 2010 Constitution. So dire is the situation that the health unions are contemplating a reversal of the function assigned to devolved units as stipulated in Schedule 4 of the Constitution back to the national government if the talks with President William Ruto during an engagement in February on the subject is to be considered.
As to our functional public health care, we need to have a centralized body, just like the TSC, just like the police, whereby there's a budget for health care that goes to health functions, and that ensures that as actual employment of healthcare workers, there's actual drugs in those facilities. The facilities that have been erected or built in the counties run. That can't happen in this aspect of devolution.
On their part, they claim Kenyans have been shortchanged, opening up a loophole for embezzlement of funds through healthcare projects. According to the 2023-2024 budgetary allocation, Treasury has allocated 380 billion shillings, up from 350 billion in the previous financial year. This is out of a total of 3.641 trillion shillings. That notwithstanding, the 380 billion divided among the 47 counties as equitable share in the current financial year for all the devolved functions. According to the 2021 Abuja Declaration, 15% of the health budget should go to healthcare and another 15% should go to health operations, meaning counties ought to receive 30% of the healthcare budget for healthcare and operations.
The following areas have been heavily affected by the said interference of the Ministry of Health in the execution of devolved health functions. 1. Primary health care delivery. 2. Engagement of community health promoters. 3. Attempted establishment of primary care networks. 4. Creation of institutions and authorities within the sector that carry out devolved functions. Additionally, the Council of Governors calls upon the Ministry of Health to desist from clawing back the health function and stop invading the roles of county governments.
Inasmuch as counties are beating their chests saying they can keep up with deliverables, the reality is that 85% of the health budget still remains with the national government, with the national government functions solely being health policy and management of national referral hospitals. This leaves counties grappling with funds as 60% of the allocated budget goes to payment of salaries and 40% goes to operations.
When it can't work for 10 years, we have to get a model that will make it work. And I keep on saying this, and this is a reality. This is why the governors, their deputies, the senators, the MPs, and all these elected state officers, both in the national and county government, they don't visit public hospitals, despite the fact that they run them. Why? Because they know that it cannot help them. It cannot help their families. So why do you cling on it to run it when you cannot get services from it yourself?
Most of the counties and our facilities have no drugs because we are stuck because KEMSA, with what is happening there, does not have any supplies in stock. And therefore, we are also staring at a further crisis. Apart from having no monies, the counties have no drugs. We are turning to private sector.
The unions are now calling on the standardization of healthcare across the country, a move which they believe will strengthen the healthcare system, as functions will be managed by a centralized healthcare system. Helen Aura, NTV.